1. In mentoring new technicians on IAHCSMM standards, which adult learning principles should guide instruction? A. Prioritize memorization of sterilization steps without context. B. Link training directly to daily work responsibilities. C. Teach all standards in a single lecture session. Avoid feedback to encourage independence. 2. When developing a curriculum for central service staff, the most effective approach is A. Providing only theoretical knowledge. Using scenario-based simulations aligned with IAHCSMM guidelines. C. Minimizing learner interaction to save time. D. Delivering content without assessment. 3. A supervisor evaluates staff compliance with decontamination procedures. What is the most appropriate evaluation method? A. Written exam only. B. Direct observation with performance checklists. C. Relying on self-reported compliance forms. D. Group discussion without verification. 4. When teaching sterilization monitoring, how should feedback be structured for adult learners? A. Provide immediate, constructive feedback focused on practice. B. Delay feedback until annual reviews. C. Limit feedback to written policy references. D. Provide only corrective criticism without praise. 5. Which of the following best demonstrates regulatory compliance with IAHCSMM standards? A. Following only facility preferences. B. Consistently applying AMI and CDC guidelines in practice. C. Creating ad hoc protocols during emergencies. D. Ignoring updates until surveyed. 6. During mentoring, what communication method is most effective for reinforcing safe handling of surgical instruments? A. Passive lecture slides. B. Demonstrations with hands-on practice. C. Reading policy manuals aloud. D. Providing written quizzes only. 7. Which curriculum development principle ensures sustainable learning in central services? A. Sequencing topics from simple to complex tasks. B. Presenting all complex concepts first. C. Excluding practical skills from the syllabus. D. Relying solely on written instruction. 8. A preceptor notices a new employee repeatedly misidentifies loaner instruments. The best mentoring technique is A. Assigning extra independent reading. B. Facilitating guided practice with feedback. C. Ignoring mistakes to reduce pressure. D. Relying on peer correction only. 9. How should evaluation data be used in a central sterile training program? A. To identify learning gaps and adjust instruction. B. Only to complete HR files. C. To rank employees against each other. D. To validate program completion without improvement. 10. Which principle of adult learning is most relevant when teaching IAHCSMM updates? A. Adults learn best when training is relevant to their role. B. Adults rely mainly on rote memory. C. Adults require minimal context for new information. D. Adults prefer passive instruction. 11. In designing an IAHCSMM compliant assessment, the best method to test emergency sterilization knowledge is A. Multiple choice only. B. Simulation-based drills with evaluation checklists. C. True-false quizzes. D. Open-ended discussions. 12. A mentor supporting a staff member with low confidence should A. Offer positive reinforcement during skill practice. B. Assign difficult tasks without support. C. Minimize communication to build resilience. D. Delay feedback until skills improve. 13. What is the most effective way to ensure communication compliance during shift handovers in central services? A. Relying on informal word of mouth. B. Implementing standardized handoff checklists. C. Leaving notes in the break room. D. Encouraging casual updates only. 14. When developing continuing education modules, the instructional design should prioritize A. Active problem-solving activities. B. Passive lecture-only content. C. Repetitive memorization drills. D. Exclusive reliance on textbooks. 15. In regulatory audits, what demonstrates effective evaluation in central service operations? A. Documented competencies with periodic reassessments. B. Informal observation without records. C. Verbal confirmation from staff only. D. Training completion certificates without verification. 16. When staff resist new IAHCSMM protocols, the best supervisor response is A. Facilitate discussion, linking changes to patient safety outcomes. B. Mandate compliance without explanation. C. Ignore resistance to avoid conflict. D. Post new policies without communication. 17. How can peer mentoring strengthen IAHCSMM compliance in the workplace? Experience staff modeling correct practices. B. Encouraging shortcuts for efficiency. C. Minimizing interaction between staff. D. Using only external trainers. 18. What evaluation tool best measures learner retention after central service training? A. Written policy review only. B. Post-training performance audits. C. Attendance records. D. End-of-course surveys only. 19. A preceptor creates a case-based scenario on instrument sterilization errors. This aligns with which adult learning principle? A. Learning is strengthened when tied to real-world problems. B. Adults prefer abstract learning without context. C. Adults require no practical application. D. Adults learn best with minimal engagement. 20. When teaching infection prevention, what method ensures regulatory alignment? A. Integrating OSHA, CDC, and AMI standards into case studies. B. Focusing on only one regulatory source. C. Developing in-house protocols without references. D. Excluding regulations to save time. 21. How can supervisors ensure long-term compliance with IAHCSMM standards? A. Conduct regular audits and feedback sessions. B. Provide one-time training with no follow-up. C. Assign policy reading without testing. D. Delegate compliance to staff alone. 22. Which evaluation method best supports continuous improvement in sterile processing education? A. Ongoing formative assessments. B. Annual exams only. C. Informal peer discussions. D. End-of-year group feedback. 23. Effective mentoring in central services involves A. Coaching, feedback, and skill modeling. B. Assigning tasks without guidance. C. Avoiding corrective feedback. Relying only on group training. 24. In developing a central service curriculum, alignment with IAHCSM standards ensures A. Standardized practices across facilities. B. Inconsistent training delivery. C. Exclusion of national guidelines. D. Focus only on institutional preferences. 25. A new technician asks why wrapping instruments must follow specific guidelines. The mentor's best response is A. Explain how proper wrapping maintains sterility and patient safety. B. Insist compliance without explanation. C. Suggest learning by trial and error. D. Refer them only to the policy manual. 26. How should supervisors use evaluation results to improve training? A. Modify modules to address identified weaknesses. B. File results without analysis. C. Use scores solely for promotion. D. Avoid feedback to learners. 27. During regulatory inspections, the best demonstration of compliance is A. Documented competencies and updated policies. B. Verbal assurance of compliance. C. Reliance on informal notes. D. Training without documentation. 28. When building communication skills in staff, which strategy is most effective? A. Role-playing high-risk scenarios. B. Limiting discussions to policy readings. C. Encouraging silence to avoid mistakes. D. Providing only written memos. 29. Which adult learning strategy enhances retention of IAHCSMM safety protocols? A. Experiential learning with immediate application. B. Memorization of checklists without context. C. Exclusive use of theoretical lectures. D. Independent reading only. 30. In mentoring, how can preceptors model regulatory compliance effectively? Consistently practicing and explaining correct procedures. B. Delegating compliance to learners. C. Demonstrating shortcuts to save time. D. Ignoring updates until mandated. 31. A supervisor wants to evaluate communication effectiveness in handoff reports. Which method is best? A. Reviewing handoff documentation and observing shift changes. B. Asking staff informally. C. Skipping evaluation to save time. D. Conducting written tests only. 32. For adult learners, the most effective way to reinforce IAHCSMM policy changes is A. Interactive workshops with Q&A. B. Silent reading assignments. C. Posting memos in break rooms. One-time emails. 33. The role of mentoring and professional development for sterile processing staff is to support ongoing learning, confidence, and compliance. B. Replace all formal training requirements. C. Avoid feedback to reduce dependency. D. Provide only occasional policy updates. 34. When mentoring a new sterile processing technician, which approach aligns best with adult learning principles? A. Providing long lectures without hands-on opportunities. B. Encouraging self-directed practice with guided feedback. C. Requiring the learner to shadow silently for several weeks. D. Delivering memorization drills before practical tasks. 35. Which of the following evaluation methods most effectively measures both knowledge retention and practical application in central service training? A. Multiple choice written exam only. B. Peer observation with informal notes. C. Combination of simulation-based assessments and written testing. D. Supervisor feedback session without structured criteria.